Usually, when we talk about a medical diagnosis, there's this expectation of precision, like engineering, right?
Right.
You break your arm, you get an X-ray, it shows that jagged white line, the doctor just points and says, there it is.
Exactly. It's very black and white.
Yeah. But when it comes to veterinary medicine, especially when we're looking at adult dogs, suddenly that X-ray machine feels like it's broken.
Yeah, it really does.
We are looking at a diagnostic landscape that is just incredibly murky. So our mission today on this deep dive is to explore a really fascinating stack of notes from a Canine Health Academy.
And this is specifically focused on adult border collies, right?
Yes, exactly. We're extracting the crucial aha moments from their curriculum on preventive care. And the main goal for you listening today is to understand why the longest and honestly seemingly easiest stretch of a dog's life adulthood is actually where owners make the biggest, often unseen mistakes.
I mean, it is the absolute definition of diagnostic muddy waters.
Totally.
Adulthood lacks the chaos of puppyhood, right? And it also lacks that obvious, visible physical decline you see in the senior years.
Yeah, they just seem completely fine.
Exactly. Because a healthy adult dog is in their prime, it creates a very specific kind of risk for the owner. It creates this illusion of permanence.
Oh, the danger of complacency. Your dog seems totally fine. They're running, they're catching frisbees, eating their food normally.
Playing at the park, yeah.
Right. Everything appears perfectly normal on the surface. And because of that, it's just so easy to slip into this passive mindset of, well, we'll deal with things if they come up.
Yeah.
Okay, let's unpack this. Because the entire core thesis of the Academy curriculum we're looking at today is that preventive care actively, almost aggressively pushes back against that exact passive mindset.
Yeah, because preventive healthcare operates on a biological reality that we, frankly, often forget.
Which is what?
By the time a problem is actually visible to your naked eye, you are already operating at a massive disadvantage.
Wow.
Yeah, the structural damage or the disease progression, it's already happened. So the goal isn't just, fixing what's broken. It's manipulating the dog's environment and their biology to prevent the break from occurring in the first place.
Or at least catching the microfractures before the whole system just completely fails.
Spot on.
Which honestly begs the question of why waiting and seeing is so uniquely dangerous in dogs compared to us. Like, if I have a stomach ulcer, I'm going to wince, I'm going to complain, and eventually I'll go to the doctor long before it ruptures.
Right, you communicate it.
Exactly. But the Academy notes dive deep into the biological and evolutionary reasons why a dog just won't do that.
And what's fascinating here is the actual evolutionary mechanism at play.
Yeah.
Dogs are instinctively hardwired to mask their discomfort.
So they're hiding it on purpose.
Basically, yeah. I mean, this isn't them just being tough or, stoic. It is a literal survival trait passed down directly from their wild ancestors.
Because showing weakness is dangerous.
Precisely. In a wild pack dynamic or, against predators, showing weakness or pain makes you an immediate target. You either lose your status in the pack or you lose your life.
Wow.
So their endocrine system actually supports this masking. When they are active or stimulated, a surge of adrenaline and cortisol can literally override the physical sensation of pain.
Okay, so waiting for a dog to show symptoms is basically like driving a car where the check engine light has been intentionally disconnected by evolution.
The check engine light is disconnected, yes, and it's even worse than that. The dog is actively trying to hide the smoke coming from under the hood.
That is wild to think about.
Right, like you might have a border collie with early-stage osteoarthritis in their hip.
Okay.
At the park, chasing a ball, their drive and that massive adrenaline surge completely mask the joint pain. They look totally flawless to you.
So they're just running through the pain without even knowing it.
Exactly. It's only hours later when the adrenaline drops and they're, just resting on the rug that the inflammatory response actually catches up to them.
Oh, man.
But by the time they are consistently limping, that cartilage has already suffered significant irreversible degradation.
And that biological reality, that intentional hiding of the smoke, as you said, is why the annual veterinary wellness exam is presented in these notes as the absolute centerpiece of adult care.
It has to be.
because you literally can't rely on the dog to tell you they're sick. So you need a professional physically looking for the things that the dog's biology is trying to conceal.
Exactly.
And the notes lay out what a vet is actually doing during one of these exams for a healthy adult border collie. And it is this comprehensive, super hands-on physical assessment.
Yeah, they're not just petting the dog.
Right. They are listening to the heart and the lungs. They're palpating the abdomen, checking the lymph nodes. They examine the eyes, the ears, the mouth, the skin.
Yeah, all of it.
And they are putting hands on the joints and actively manipulating the range of motion.
The clinical value of that hands-on manipulation just, honestly, it cannot be overstated.
Because they're feeling for things we'd never notice.
Right. When a vet is palpating the abdomen, they aren't just giving a belly rub, They are feeling for the specific size and texture of the liver and the kidneys.
Oh, wow.
They're feeling for abnormal masses or fluid buildup that the dog is completely oblivious to. And when they use a stethoscope, they are listening for the turbulent blood flow of a subtle heart murmur.
Like a mitral valve issue or something.
Exactly. Long before that failing valve causes fluid to back up into the lungs and, triggers a cough.
So they are hunting for the invisible clues.
They really are. They are mapping the internal state of the animal against a standard of health. A small mass under the skin might be benign, sure, but it might be a mast cell tumor.
Right.
Subtle joint stiffness might just be a sign to start a joint supplement right now before it becomes a torn cruciate ligament later. These are findings that require real clinical tactile intervention.
Well, we just talked about the internal abnormalities a vet is feeling for during an exam. But some of the most dangerous threats are the invisible invaders attacking the dog from the outside or, and this is gross, taking root right in front of us.
Oh, yeah.
And the first one the curriculum highlights is parasites. Now, I think a lot of canine enthusiasts associate heavy parasite prevention with puppyhood.
Right, the early shots and everything.
Yeah, early immunological needs, initial deworming protocols. And then you kind of relax as their immune system matures.
Which is a mistake.
Yeah, the academy curriculum heavily stresses that adult prevention for fleas, ticks, intestinal parasites, and mosquito-transmitted heartworm. It has to be a year-round tailored strategy.
The mechanics of how these parasites actually cause damage makes that year-round prevention so critical.
How so?
Take a tick, for example.
Yeah.
It isn't just a nuisance that causes some itching. Certain ticks transmit pathogens, like the bacteria that causes Lyme disease.
Right, Lyme is terrible.
And once that bacteria enters the dog's bloodstream, it often settles in the joints, triggering a really severe autoimmune response in polyarthritis.
That sounds awful.
Or consider heartworms. Mosquitoes transmit these microscopic larvae. And if they're left unchecked, those larvae migrate to the dog's heart and pulmonary artery.
Wait, they go straight to the heart?
Yeah, and they can grow up to a foot long.
Oh my gosh, a foot.
A foot long. They physically crowd the vessels, forcing the heart to pump incredibly hard just to move blood past them. And that ultimately leads to right-sided heart failure.
Okay, but you mentioned mosquitoes. I think the common assumption is, well, it's winter, there's snow on the ground, there are no mosquitoes, so I can definitely skip the heartworm pill for a few months.
Right, people do think that, but
yeah.
It ignores the reality of microclimate.
Microclimates.
Yeah. Mosquitoes can actually survive in basements, in heated garages, under porches during cold snaps. So a border collie living in an urban apartment complex with, say, heated underground parking faces a totally different environmental risk profile than one living out on a farm.
That makes total sense.
This is why the protocol has to be tailored by a veterinarian based on your specific region and your specific lifestyle, rather than just relying on seasonal guesswork.
Okay, so here's where it gets really interesting. The sources dedicate this massive section to dental health. They label it genuinely one of the most underestimated areas of preventive care across all dogs.
Oh, absolutely.
Now, wait, I need to stop you there. I brush my dog's teeth because his breath smells bad, and maybe, I don't want him to lose a tooth when he's old.
Sure, that's the cosmetic side.
Right. But are you seriously saying a dirty tooth is a systemic danger? Like, how does bacteria in the mouth even reach the rest of the body?
Well, if we connect this to the bigger picture, the mouth isn't a closed system. It's a highly vascularized gateway.
Okay.
Here is the biological pathway. When plaque builds up on the teeth and isn't brushed away, it hardens into tartar.
Right, that hard yellow stuff.
Exactly. That tartar irritates the gums, causing gingivitis.
Yeah.
And as the gums become inflamed, they begin to actually pull away from the tooth, which creates these deep pockets.
And those pockets become breeding grounds for bacteria, I'm guessing.
Exactly. Highly destructive anaerobic bacteria. And because the gum tissue is so heavily supplied with blood vessels, and those vessels are now inflamed and compromised,
Wait.
the simple act of the dog chewing their food
Hmm.
actively pumps that bacteria directly into their bloodstream.
Oh, wow. So bacteremia-like. Bacteria literally circulating in the blood just from eating dinner.
Circulating directly to the vital organs, yes.
That is terrifying.
It is. The kidneys and the liver are the body's filters, right? So they are suddenly bombarded with oral bacteria, which can cause microscarring and accelerate organ failure over time.
Just from bad teeth.
Yeah. It can also settle on the valves of the heart, causing endocarditis. So skipping dental care isn't a cosmetic issue at all. It is actively allowing a daily infusion of bacteria into your dog's cardiovascular system.
See, that is a massive aha moment for me. It completely changes how you view brushing your dog's teeth.
Right.
It's not about fresh breath. It's about protecting their heart and liver. And the curriculum provides a very clear two-part strategy for this. First, home care. Regular brushing mechanically disrupts that soft plaque before it can harden into tartar.
You got to sweep it away.
Yeah. And they emphasize that even if your adult Border Collie has never had their teeth brushed, it is never too late to start by just introducing it gradually.
It just takes a little patience.
Totally. And then the second part is professional cleanings under anesthesia by your vet.
Right, and that professional cleaning is non-negotiable over the course of a dog's life.
Why is that?
Because a toothbrush simply cannot reach below the gum line. And as we just discussed, those subgingival pockets, that's where the systemic danger actually lives.
Okay, so we've covered the medical interventions, the physical exams, the parasite protocols, the deep cleanings.
The clinical stuff, yeah.
Yeah, right. But the sources shift heavily into the daily lifestyle choices that basically act as their own form of preventive medicine. Because you are only at the vet a few times a year.
At most.
Yeah. So the rest of the time, your daily habits are the armor. And the biggest pillar of that armor, weight management.
Yes. Excess adipose tissue, or body fat, is often fundamentally misunderstood by owners.
I feel like we just think of it as extra padding.
Exactly. We tend to view fat just as extra weight that the dog has to carry around, making them pant or get tired faster. But adipose tissue is actually biologically active.
Active? Like doing what?
It functions almost like an endocrine organ. It is continuously secreting pro-inflammatory hormones right into the dog's bloodstream.
So an overweight dog is effectively living in a constant state of low-grade systemic inflammation.
Yes, all day, every day.
Wow.
And that chronic inflammation degrades cartilage in the joints, it alters insulin resistance, which leads to diabetes, and it puts a massive physiological strain on the cardiovascular system.
So it's not just about looks.
Not at all. Maintaining a lean body mass isn't just about athletic performance. It is literally about turning off that inflammatory tap.
And you can't just look at a fluffy dog and know if they are lean, especially a Border Collie with all that fur.
Oh no, the fur hides everything.
Right. The curriculum describes a specific tactile home body condition check. You have to actually put your hands on them.
You have to feel for it.
Yeah. When you run your hands along their sides, you should be able to feel the individual ribs without having to press hard through a layer of fat.
Right.
And from above, they should have a distinct waist tucked in behind the ribs. And from the side, the abdomen should tuck upward, not just hang level with the chest.
Relying on the scale at the vet's office once a year is way too late. The visual and tactile checks really need to happen monthly.
I was thinking about how dogs actually gain this weight, and it reminds me of lifestyle inflation in personal finance.
Oh, that's a great comparison.
Right. You get a raise, you start buying the slightly more expensive coffee, you add a subscription service here and there, and it happens so slowly you don't even realize you are tapped out until you check your account.
Exactly.
With dogs, it's treat creep. A little piece of cheese while you're cooking, an extra training treat, a dental chew that randomly has 100 calories in it.
It adds up fast.
It does. It happens so incrementally that the biological system gets overloaded before you even notice they've lost their waistline.
Treat creep is a perfect characterization. And the antidote, aside from strict calorie awareness, is exercise. But the curriculum is very careful to define the physiological purpose of exercise for an active breed.
It's not just fetching, right?
Right. For a Border Collie, exercise isn't just about burning calories or draining their mental energy so they, don't herd your children in the living room.
Which they will absolutely do.
They will.
Yeah.
But physical activity is literal, structural, prevented medicine.
Let's get into the mechanics of that. How does running actually protect their structure?
Well, consider the anatomy of the canine leg. The bones, the ligaments, and the tendons, they rely entirely on the surrounding muscle mass for stability.
Okay, so the muscle holds it all together.
Yes, consistent physical activity builds and maintains dense muscle fibers. When a dog jumps to catch a frisbee and lands, those strong muscles act as their primary shock absorbers. They take the kinetic energy of the impact and they just dissipate it.
But if they are sedentary, or maybe their muscles have started to atrophy.
Then the muscles fail to absorb the shock.
Oh no.
And the sheer force of that landing is transferred directly into the joint capsule, specifically into the cartilage and ligaments, like the cranial cruciate ligament, which is notorious for tearing in active breeds.
Because it took the whole hit.
Exactly.
Yeah.
So daily exercise is literally building the kinetic armor that protects the dog's skeleton.
Building the armor. I really love that. So we have all these daily defenses, brushing teeth, controlling portions, building muscle. But how do we actually measure if any of this is working on an internal level?
Right, that's the tricky part.
Yeah, which raises this important question about tracking health. And that brings us to the concept of the baseline.
Veterinary medicine relies heavily on establishing a biological map for each individual patient. The curriculum strongly advocates for routine blood work and organ function screening during the adult years.
Even for healthy dogs.
Yes,
Yeah.
even when the dog appears to be in peak physical condition.
And look, I have to admit, reading that gave me pause.
Sure.
Because if my Border Collie is 3 years old, he's running circles around me, eating perfectly. Why am I spending $300 on a blood panel?
It feels unnecessary.
Right. Isn't that just a clinic looking to run up a bill on unnecessary diagnostics?
It is a super common hesitation, but it really stems from a misunderstanding of what a lab result actually is.
Okay, explain that.
Textbook normal ranges for, liver enzymes, kidney values, or red blood cell counts. Those are just statistical averages across millions of dogs.
Just a general bell curve.
Exactly. But your specific dog's internal chemistry might naturally sit at the very high end or the very low end of that textbook range.
Oh, I see. So if a liver enzyme, say ALP, is technically elevated when they're 8 years old, the vet might panic and order an ultrasound.
Right.
But if they had blood work from when the dog was 3, they might look at it and see, oh, wait, this dog's ALP has always naturally run slightly high. This isn't disease. This is just their normal.
Exactly. You are paying for a customized reference point.
Yeah.
When that dog is 8 or 9 and an enzyme shifts slightly, the veterinarian isn't guessing if it's a new pathology or just a lifelong quirk.
That makes total sense.
The baseline makes detecting true early-stage disease exponentially more precise.
You are basically investing in data for the future.
Exactly.
The clinical data from the vet is only half the equation, right? The Academy notes pivot from what the vet can measure to what they describe as the owner's absolute superpower, daily observation. Because the vet sees your dog for, 45 minutes a year? You see them every single day. You know the exact rhythm of their life.
And because of the evolutionary masking we discussed at the very beginning, the adrenaline hiding the pain, the earliest possible signals of a systemic problem are almost never a pronounced limp or a sudden collapse.
They're way smaller than that.
Way smaller. They are incredibly subtle shifts in routine or appearance that honestly only the person living with the dog would ever notice.
And the curriculum provides an excellent framework for this home monitoring. First, they focus on the skin and coat. You aren't just looking for fleas, you are looking for dullness in the fur, dry skin, or sudden shedding.
Right.
And the biology behind that is fascinating. If a dog is developing early kidney disease, for example, their body goes into triage mode.
It shuts down the non-essentials.
Exactly. It diverts nutrients and blood flow away from non-essential systems like growing shiny hair to protect the failing vital organs. So a dull coat is often the very first visual alarm bell of internal organ distress.
And the exact same logic applies to behavioral shifts.
Like what?
Like an adult dog that suddenly starts sleeping an hour longer every morning, or shows just a slight hesitation before jumping into the back of the car.
Things we just assume mean they're getting older.
Right. People think, oh, they're just aging. But that behavioral shift is actually their body conserving energy to fight off an inflammatory response or an underlying infection.
Wow. The checklist also specifically calls out paw health, which is obviously incredibly crucial for a working or athletic breed like a Border Collie. You are checking the pads for clacks or unusual wear patterns.
Because paw health dictates the entire biomechanical chain.
How so?
If a dog has a cracked pad, Or if their nails are alive to grow too long, it literally changes the angle at which their foot strikes the ground.
Oh, so it misaligns everything.
Exactly. That tiny geometric shift alters the alignment of the wrist, which changes the angle of the elbow, sending abnormal rotational stress all the way up into the shoulders and the spine.
Wait, really?
Yeah, a neglected nail trim can literally cause back pain.
That is insane. But the notes offer a lot of reassurance here, too. When you are looking at their eyes for cloudiness, or smelling their ears for a yeast infection, or noticing they're eating a little slower, your job as the owner is not to diagnose the problem.
Right, you don't need a medical degree.
Yeah, you don't need to know the physiological pathway of why the fur is dull. Your only job is to be the scout. Notice the deviation from the baseline and report it to the doctor.
The owner is the scout, gathering the intelligence, and the veterinarian interprets it.
Which honestly highlights a massive amount of information management falling on the owner's shoulders. Vaccine dates, specific parasite prevention schedules, monthly weight checks, blood work results, dental history. It is a comprehensive medical history.
A lot to keep track of.
It is. The sources actually mention a concept or a tool called VitalPet. It's an organizational tracking system to keep all this layered data in one place. Now, the notes are very clear about this. VitalPet doesn't diagnose anything.
No, of course not.
It doesn't offer medical advice, and it absolutely never replaces your licensed vet. But it solves the problem of data fragmentation.
And data fragmentation is a huge hurdle in veterinary medicine.
I can imagine.
If your dog needs to see a veterinary orthopedic surgeon, or if you move across the country, or even simply experience an emergency while traveling, having that complete layered picture of your dog's baseline readily available is critical.
So you aren't relying on your fuzzy memory.
Right. You aren't trying to remember what year they had that weird liver enzyme spike, and you aren't sitting there waiting for a clinic receptionist to fax over old records.
Having that data organized makes you a competent medical co-pilot for your dog, and it all really feeds into the ultimate philosophy presented in this curriculum, the profound value of building a long-term relationship with a trusted veterinarian.
It's foundational.
When you show up consistently for wellness visits, specifically when your dog seems perfectly healthy, you are building a partnership. A vet who has put hands on your dog for years, who understands their individual biological map, is in a fundamentally superior position to catch the invisible threats.
It is a philosophy of layered defense.
Yeah.
Routine, hands-on exams, targeted parasite prevention, deep dental cleanings, lean muscle management, chemical baselines, and, of course, your daily watchful eye.
Right.
No single layer guarantees perfect health. I mean, biology is just too unpredictable for guarantees.
Definitely.
But layered together, they create a really robust safety net that intercepts problems before they become catastrophic.
It is the ultimate act of care. I mean, think about it. We spend hundreds of hours trying to teach our dogs how to communicate with us.
Oh, yeah.
We teach them obedience commands. We train them to ring bells to go outside. We teach them tricks. We desperately want them to speak our language. But considering their deep evolutionary instinct to silently hide their pain and vulnerability, what if the most profound communication they ever offer us isn't a behavior we taught them?
That's a fascinating thought.
What if their true communication is simply the rhythm of their daily baseline routine? The real question isn't whether our dogs are speaking to us. It's whether you are paying close enough attention to the data to notice when their silence changes.